And these are two really vital foundations to one's retirement plans. And so hopefully we've got a great program for you in our preparation stage. We've got two great speakers to present to you. I'll tell you about them in just a moment. I want to mention to you that we're recording our presentation today, with any luck anyway, and we'll plan on putting it on our website probably tomorrow. So if you want to go back and review any of this, that'll be helpful to you. And feel free to share it with anyone else. It's going to be available for the public. And but I do want to say, from a compliance point of view, if you have a question, we are recording it, so your participation implies consent. And what else? We'll have some important disclosures at the end. But as always, information is derived from sources thought to be reliable, but things can change. So be attuned to that. Okay. So and see our disclosures at the end of the presentation. Let me tell you a little bit about myself, really just to give you some confidence in me and my team. I've been doing this financial planning for, well, it's coming up on 30 years roughly, with from the time I started as an insurance agent and then became an investment advisor and ultimately started what's become Asset Management Resources. And over the time, CFP, Certified Elder Planning Specialist, Chartered Advisor for Senior Living. These are designations geared toward the kind of issues retirees face. Had a radio show for 16 years, not exactly a credential, but it keeps me on my toes. So in any case, been involved with the Financial Planning Association, as has Jeff Demaning, who's in the back, one of our advisors. And let me tell you about our team, because it's not just about me. We've got a great group of people that help us at Asset Management Resources. Jeff is in the back. Jeff, you might as well stand so people can see you. Very good. Jeff's also a past president of our local Massachusetts, now New England chapter of the Financial Planning Association. Been with us for a few years and has been in the industry also for 20, 25 years, something along those lines. We have a great team. Kristen is also here with us, my wife, Kristen, but Kristen's also a registered individual. She helps with our client service activities. We've got Brian Regan, who's not here today. He's our Chief Investment Officer. Scott Birmingham, our Chief Compliance Officer, as well as our lead financial planner, who helps you if ever you have an interaction with us. You'll probably talk to Scott along the way. A couple of our advisors, Kathy Ingersoll is our marketing person, and she's got us all set up. Getting waves from the crowd. All right. Yeah. There we go. Excellent. So in any case, we've got a great team, and hopefully at some point you'll have, if you're not a client already, you'll have an opportunity to interact with members of our team. We do have office here on Hyannis and Cape Cod, as well as a presence in Boston. We have an advisor in Nashville and in Port St. Lucie, Florida. So with that, I was thinking before I jump into this slide, Social Security and Medicare in the news all the time, it seems like. I just was the last couple of days, I printed these off since we were having this talk. I got one related to what's happening with Social Security after the debt ceiling, issues, and another one talking about, what's going to happen with the WEC and the GPO provisions. There's talk about changing these possibilities. We're going to hear all about these kinds of issues. When it comes to both Social Security and Medicare, these are so important questions and so many issues that we face. So whether it's, you're dealing with issues as a divorced person, a widow, a past municipal employee, am I qualified? Am I eligible? What will my benefits be? How does it work? You're going to hear all about this. When it comes to Medicare, Medicare is a challenging, how's this system work? There's A, there's B, there's C. What is it, right? We're gonna go through all that, and we've got some great presenters. Let me tell you about our presenters as well. Marcia Mantell is, I'll find my right page here. So we've got the two powerhouse presenters. Marcia is not only an author, she's a regular presenter on complex retirement concepts and regulations. She's written extensively as a guest columnist for over 30 years. She is considered a retirement industry go-to person on Social Security expert level information. And if you haven't seen it, we had some on the back table. Her book, What's the Deal with Social Security for Women, as well as there's a cookbook, so to speak, about your financial planning. So in any case, and then as for Susan, for over 20 years, Susan has been a consultant in dealing with Medicare issues. Like Marcia, Susan's really an educator when it comes to these kinds of presentations. She does a great job understanding what are the things that we need to understand, how to convey it, and I think you'll find that as you hear their presentations. So I've had the benefit of seeing both of our presenters present, both to our clients and at other events. And I know for a fact you're going to find the content very valuable. So let's get right to it. And let me welcome Marcia Mantell.
Thank you, Chris. Thank you. Thank you. Thank you.
Okay.
I need more hands.
Yeah. Oh, I'll take that.
Yours. Okay.
Thanks.
Well, good morning.
Good morning.
Morning. Bright and early on a, I don't know, thunderstorm, hailing kind of day. But it was beautiful driving down. My office is in Plymouth, so I'm just out on the Pilgrims and me, we get together and have lunch from time to time. And we talk about Social Security. You know, it wasn't around that much back in 1620, but today we have this crazy, crazy system called Social Security. And it is so important. Chris, as you said, it is the foundation to your retirement income. Because once you don't have a paycheck coming in, well, the bills still do come in. So how will you cover them? So how many, show of hands if you don't mind, how many of you are already retired? Anybody? Oh, not too many. Okay, a few of you. Yay. How's retirement going? Yeah. Oh, yeah, I've got big cheers. That's awesome. So have you already kind of figured out your Social Security plans? No, okay. So retired, but independently wealthy. That's what I'm hearing here. Excellent. All right, well, let's talk about what you need to think about with Social Security. And so I thought we'd do 4 things today. And please write your questions down. You've got little pads of paper and such. You may have some, both Susan, well, all of us, Chris, Susan, and I will be here at the end of the session for more questions. But at the end of this topic, we will have a few minutes for a couple of simple questions. Don't give me something really hard and complex. We'll have a few minutes. But we're going to talk about why do we even have Social Security? What's it for? Why do you need to know that? How is the benefit calculated? That might be the most important piece of the equation. If you understand what's going on behind the scenes, you can make better decisions about when and how to claim Social Security. Then there's how will you claim? And Chris, you're spot on with the, if you're divorced, there's going to be one lane you go down, but if you're married, there's a different lane. And it's important to know the differences and what to think about depending on your marital status. That's the key nugget with Social Security. And then surprises. There are just so many surprises with Social Security. You know, how are you going to plan for them? How will they affect you? So let's just jump in and think about Social Security as a law. The law was created back in 1935 with our Congress at that time. FDR was in office. We have a raging recession. Well, actually, it's the Great Depression. We're trying to come out of that after the crash of 1929. And we have older people not able to put together basics. Roof over your head, food on the table. That's not okay in a civilized, developed country. So we have Social Security, and it is designed very specifically to provide insurance. Well, what are we insuring? We're ensuring that you're going to live a nice long time. You're going to have a 30-year retirement, and you need to pay for stuff when you're living a long time with no paycheck. So it's insurance. It is for retirement. This is not an investment. This is not an asset class. It's your income. It's doled out in monthly increments. And the law was designed and developed and then amended and changed over time with the spirit of fairness for all. So this is the fundamental basics to Social Security. Retirement income delivered as insurance if you live a long time. So Chris, that's funny that you found several articles every day. For those of you who read anything online or still get a newspaper, there's something about Social Security going bankrupt. There's something about Medicare. But then the next day will be reversed. So one day Social Security is going bankrupt. The next day we're well funded. The next day it's something else. So is it going bankrupt? That's what the headlines are telling you. Do you think it's going bankrupt? Well, it's not. It's here. It is a law. Laws don't just disappear. Oh, not only is it a law, it's about 4,800 pages. The printed copies are in my office, should you ever want to see them. This is a massive law. And again, it's meant to protect us in our older age. Congress people don't get reelected when you make the older people unhappy. We vote. It's going nowhere. It's wobbly though, right? It's not as secure as it had been. We're delivering income on a consistent basis. But right now, 51 million American retirees are getting their foundational income from Social Security. Another 6 million survivors, meaning husband or wife has passed and their kids, and 9 million disabled Americans. This is a tremendous program servicing literally tens of millions of us. And the rest of us are just waiting our turn to get in. It's going nowhere. And that's partly and largely because I call it this pay to play system. You just don't magically get Social Security because you're older. You had to have paid in. You pay in, your employer pays in, all this money every week. You know, it's fueling the trust fund. And the trust fund is huge. We brought in $1.057 trillion last year. Boy, if I only had my 1.057 trillion, I'd feel a lot more secure. Well, that's the trust fund. And then, as my dad likes to say, I've earned all this. He appreciates all of you still working because that helps him get his check every month. You know, we pay while we're working and young, we pay FICA. It goes into the trust fund and then immediately goes out to pay our retirees. That's the law. That's how the system works. But there's more to it than that. You don't pay in some amount and then just get that same amount back. If you did, you would all be done with your contributions and your employer contributions about 10 years into your retirement. So you'd have nothing for the next 20. So instead, it's a calculated benefit, and we'll look at that next. But just to give you an idea of how much you can expect, well, it's not as much as you were hoping for. So gentlemen, if you had, we consider the average wages throughout your career, you're going to get about $1,800 a month if you reached your full retirement age in 2023 and you collected Social Security, you claimed. Now, think about how much you're bringing home every month. Don't tell me, but is that less or more than what you're bringing home? Yeah. Ladies, we have a different problem. We get less, even less of the less. Less of a small number is still less. And this is because we have what I call popcorn careers. You know, we move in and out of our careers. We have kids, we need to do caregiving. Our wages may be lower relative to our counterpart male colleagues. So we care for our kids, then we care for our parents as we're older and our parents are still here. I just visited with my husband's parents this weekend and we were on duty down in Pennsylvania. Dan's dad turned 100 on May 11th and his mother 99 in April. So wow, they still get their Social Security checks every month. They don't get a lot, but they get them. Baseline numbers. And if you're the highest earner, making $1 million a year, wouldn't we be so lucky? You're only going to get $3,600 a month because your FICA taxes are capped. You don't get to, and every dollar you earn, you're not putting money in. So we have a formula again. It's all calculated. And it does make a big difference when you decide to claim. There's a real decision going on. And this is where I think it's so important to be either an expert at this very fun topic or working with an expert. And Chris's team will work with you on this planning. When you claim, will determine how much you're going to draw from your portfolio. I call it the chewing up of your portfolio and all the savings you work so hard to save. They work together. And I think of it like a layer cake. Anyone like cake? Oh, Jeff, excellent. Only 2 of you like cake. Really? The whole plate of pastries over there. The example doesn't work as well. Layer cakes, you put a blob of frosting down, you put the first layer on. That's Social Security. Doesn't cover all your bills. Cross that layer, next layer, your portfolio. Well, you might have a pension, you might have an annuity, everyone's going to be different. But what you have to think about is if you need $4,000 a month for your basics, and your Social Security benefit is $1,800. That is not the same as $4,000. So you've got to chew up your portfolio to the tune of $2,200 a month. If you wait until 70, though, magic age of 70, you get a whole lot more from Social Security, so you pay a whole lot less out of your portfolio. And if you claim early, and occasionally there is a reason to claim early, it is not because the program is going bankrupt though, then you take out less, you get less of a monthly benefit, so you're chewing up more of your portfolio. Now here's the big decision that you make with Social Security. People sometimes make decisions, just cause, and then they live to regret it later. And where you regret it is older ages, and when you wanted to leave a legacy. You cannot leave a legacy or bequeath Social Security. Once you're gone, it's gone. This is where you have control. So being very mindful of the decisions you're making in your early 60s and how they're going to follow you when you're 85 and 95 and 100. So make wise decisions early. And it's hard, we'd rather have the money, but it's not always the best decision. Still have to pay those bills. Oh, the differences are big. It's about $1,000 a month or 77% increase. That's big. All right, so let's look at your benefit calculation now. So it is, again, it's not the money you're putting in that's going to turn around and come back out. Instead, it goes into a calculated formula that has some key factors. The first factor is your FRA, or your full retirement age. There's a lot of terminology with Social Security, and knowing these terms will help you, again, know what's going on behind the scenes. So FRA is not 65, which many people still think it is. FRA is determined by the actuaries based on the year you were born. So those of you born in 1957, your full retirement age is 66 and 6. It is not 66. It's not rounded up or down. It is literally when you reach age 66 plus 6 months. For those of us born in 1960 or later, our FRA is 67. Yep, the last time I did this presentation, I aged myself by a year. I don't know what I was thinking. My birthday is actually July 20th, 1961. I will be 67 in July 2028. That's FRA. That's how it works. If you have any January 1st birthdays, no, don't usually find any New Year's babies, but in that case, you go 1 year earlier. You need to know your FRA first because your calculation is going to be anchored on that age. Then the formula is you're going to have an AMI calculated. AMI is average indexed monthly earnings. And what it's going to look at is all of your earnings throughout your entire career and see how much you made on average. So it works like this. You first need 40 credits. You've been paying FICA all along your career, and you've earned 40 chits or 40 credits, 1 per quarter. Usually it works out to about 10 years. Then a wage index is going to be applied to all those 1970s earnings and 1980s and 1990s. So we're going to rise the tide here and make sure that all of your income that you earned in those earlier years are closer to today's value of the dollar. Then the highest 35 years, not 3 years, not 5 years. Someone actually asked me the other day, it's like, oh, I thought it was 3 to 5 years. There's no 2, 35 years. So basically your entire career, except I can get rid of 1979. My statement shows $125 from my 2-week stint at McDonald's. So you're gonna get rid of some old small numbers, you get rid of zeros. And the highest 35 years are used to create an AMI. And what happens is you add up all these index numbers and you get millions of dollars. When you think about it, you've been working for 40 or 45 years, millions of dollars that you've earned. What is that on an average? Well, you divide by 35, divide by 12, you get an average monthly wage. Then that's AMI. Now you're going to meet PIA, your primary insurance amount. And all it's going to do is take that AMI and split it into 3 bands. Similar to the tax bracket idea. And there's a formula, 90% of a number, then 32% of a tranche, and then 15% over a higher threshold. And this is what it looks like. If someone's AMI is $3,500 a month, so that was your average monthly earnings throughout your entire career, highest 35. You bring in $1,000 in the first band, 763 in the second band, but you didn't make enough to fall into the third band. Add them up, and you would get $1,700. That's what you will see on your statement as your benefit amount at your full retirement age. So you're getting half of your average index monthly earnings. That's what you get as a benefit. Now, if your AMI is higher, these are our highest earners. So you're making taxable wage base or more. This year's taxable wage base, $160,200. So that's the range. It's not $1 million. You're making the high 100s. You are hitting the taxable wage base. In that case, you do fall into all 3 bands. Simple math, and it lives 0.9 times 11.3, and so forth. So this person is going to get about $3,500 in monthly income. But it's only 30% of their average over their lifetime earnings. It's a much smaller number. Big dollar, but it's not going to cover their expenses in any meaningful way. So that's the first piece. We have FRA, then AMI, then PIA. And then when you claim matters, and it really matters, because you can claim early. What's the earliest age you can claim? Yeah, 62. Did anyone not know that? I found no American ever across the country who doesn't know and isn't waiting for 62. Oh, by the way, July 20th, I'll be 62. So I am just about there. Well, when you claim before your full retirement age, and you can, but that money now has to stretch over more years. And if that's the case, you are going to get a nice big fat reduction. I call this the penalty zone. So you're claiming 4 years before you're really optimizing this benefit. So you're going to take a 25% permanent reduction. You don't bump up, you don't get more, except for annual cost of livings, but now it's on a smaller base. So your incremental numbers throughout your next 30 years are going to be a whole lot smaller. For those of us with an FRA of 67, we get a 30% permanent reduction. Where are you going to make that up? Yeah, your portfolio. Again, you're going to chew up your portfolio too soon. So that's the bad news about claiming, but you can also claim later. And you can claim as late as age 70. And when you do that, you are getting bonus dollars, permanently increased monthly income. All the way up to age 70, they're called delayed retirement credits. But basically you get 8% per year that you wait. But any 1 month that you wait after FRA, you're getting a little bit of bonus money. So the calculations will be done on the month. But for those of you with an FRA of 66, you get 32% more if you wait all the way till 70. And for those of us again at 67, we get a 24% bonus. But the question becomes, who can really wait until 70? First, who wants to wait until 70? Anybody here? Will you still be working, do you think, till 70? That's the key. If you're going to be working anyway, you don't need the money, you're working. So you may as well, heck, get a 24% increase for when you're old. That's awesome. But if you're already retired or wanting to retire, if you can aim for your full retirement age, you've kind of done your job. That's what this program is meant for. Now, every calculation, and Chris will be the first to tell you, well, you always do better with your overall plan if you wait till 70, because more is more. But the fact of the matter is, it's really hard for most of us to work until 70. So again, you're gonna make these decisions thinking about yourself and your family and your income needs. But make smart decisions. Know what's going on here. Yes, sir.
May I ask a question about FRA?
FRA question. Yes.
He is incrementally moving higher. Is there any anticipation that it will continue to move at the same rate that it will?
So the question is around legislation of FRA. Back in 1983, we had the 1983 Social Security amendments in the Reagan era. And that's when we all in the room got an unpleasant bump up in our full retirement age from 65 incrementally and now up to 67. So the question is, with all the swirl about trying to stabilize Social Security, are our kids going to have even a higher FRA? That is the easiest one to talk about from the media perspective. You can scare everybody. You can scare an entire nation of younger people into thinking they have to wait so much longer. Well, let me go back here for a second. This is a 5-year gap and you lose 30%. Who really claims early? It's the people in the construction industry. It's our welders. It's our truck drivers. It's the lady at the grocery store, scanning and bagging your groceries. It's the physical labor people that now make up somewhere around 60 to 70% of all the jobs in the country. We can't go higher. It's not reasonable because they will take such a hit on their broken bodies. Yeah, it gets talked about over here, but the reality when I talk to the Social Security Administration is this is not really even on the docket, because we're already hitting people with a 30% permanent reduction in this most important layer of the cake. They don't have millions of dollars saved. So it's a public policy problem. It is talked about a lot, but it is highly unlikely. The industry does not support it. The policymakers do not support it, but you'll hear the noise. Thank you for the question. That's good. All right, so now you have an idea. This is a claimed benefit, highest 35 years. Now, how do you claim? Because there are only 4 options. By the way, I love this poster. These are old posters and marketing efforts from the Social Security Administration when they were trying to get the American public to embrace this program. Imagine that. People did not want to get a handout back in the 40s and 50s. They were actively marketing, saying, you paid in, you should get this money out. And they're going, no, I don't want any money. We would never do that today. But here, when a miss becomes a Mrs., notice the ring, you get to keep your same Social Security number, but remember to change your name. So ladies, I hope you all did this. So you can only claim in one of 4 ways. You are a spouse, an ex-spouse, a surviving spouse, or an individual person, individual worker. That's it. These are our choices. But interestingly, when you think about your lifetime, you will fall into very often, well, you all fall into at least one category. You are an individual, but you might be a spouse. You might be an ex-spouse and then a spouse again. You might have killed off someone. Chris or Jeff asked me earlier, are you going to kill Dan in this presentation? Yes, but just give me a moment. That's my husband. I will not kill your husbands, just mine. So I will be the surviving spouse in all of my planning. Mostly because Dan can't cook, so he'd starve anyway. But you're going to fall into something here, and that determines how your benefit and what your options are going to be available to you. So your benefits, though, are only and ever only one single benefit, but it's the highest benefit that you're eligible for at the time you claim. So there's some comparisons going on behind the scenes, and here's how it works. If you are the lower earning spouse, and it does not matter what kind of spouse you are, you could be mean or nice, happily married, not so happily married, SSA does not care. Same-sex couples, opposite-sex couples, it's legally married people. That's who will have a lower earner and a higher earner. If you are the lower earner, that's so much nicer.
Oh, yes.
If you are the lower earner, you are entitled calculated value of 50% of the higher earner's primary insurance amount. Their calculated benefit at their full retirement age. So I'm gonna just use Dan and Marcia to make the example simpler. I'm entitled to half of Dan's or half of his. Dan's entitled to half of mine if I'm the higher earner, but it's just a calculation to consider. And there are some rules, all right? You can't just have spousal benefits. The higher earner has to be claiming Social Security already because you come coupled. So the higher earner has to be in. The lower earner, if I'm the lower earner, I have to already be 62, just a minute. The lower earner's benefit will first be on their own full retirement age, and then any amount they earn will be paid first, and then you'll get a top up. So the value is 50% of his, or if you made more than 50% of his, you're going to get yours. So it's a little bit of sequence and layering and so forth here, but the bottom line is this was set up again, 1935 is the law. Most women were where? Working or at home? At home. They got credit for helping build an economic, financial household over the years, even though they stayed home to run the house and run the kids and run the husband. So he was the worker, she got half of his. So she got a benefit, her own benefit. And her benefit would be paid first if she had any outside work history that qualified, and then the additional top up. Question in the back?
What if the spouse is a teacher who chose to have put into a social security?
Yeah, the question is here in Massachusetts, what if the spouse is a teacher? So they do not get Social Security. They instead get a pension, the teacher's pension here in Massachusetts. In that case, the spouse is not, depending how big the pension is, and I'll say she, if she's the teacher, she will mathematically, they'll look at 50% of his, but it will be offset by her pension. And typically she ends up with no spousal benefit at all. The teacher's pensions are very big here if you're a career teacher. So they are bigger than you would have gotten with the same income paying into Social Security. Massachusetts is one of those interesting states that the pension board actually does better. Now, does anyone think that's a lot of money? No, everyone's disappointed. You don't get as much Social Security, you don't get as much pension, but it's still a really good foundation to that cake. Now, what if you're an ex? So you are not married, but you have an ex-spouse. Well, rules are the same. You get half of his. He's mad, she's giddy. That's usually the way it comes down. But there are a lot of rules with this. Not just any divorced couple gets to claim on the other. The first hurdle you have got to get over, you had to have been married to him or her for 10 consecutive years or longer. So there had to be some pain and suffering involved before you get any benefit. All right, you've been divorced for 2 years or longer, or your ex is already claiming. So that's a rule. You have not remarried. If you're remarried, what are you? A spouse. So the spousal rules come into play, not the ex-spousal rules. Each of you has to be at least that you and your ex have to at least be 62. So sometimes there's an age gap there to consider. And the amount you will receive, half of his, will be higher than your own personal benefit. So some women will have zero. They were a dependent spouse at home, never qualified. So they're entitled to 50%. He's getting 2,000, she's getting 1,000. But most often in a divorce, she's also worked, even if she started later. So she'll get her first $800, let's say, and then a $200 top up. That difference is gigantic for many, many women. And it is mostly women today. Men works the same. I do have a couple of couples where he's truly a starving artist. You know, they were married and she was the breadwinner and he was the artist trying to make a go, didn't, so he'll get half of hers. Spouses are looked at higher earner, lower earner, same for exes, but you have to meet, and the biggest one is 10 consecutive years or longer. I met someone the other day who was married 9 years, 7 months. Like, dang, if I had only known this rule, you know, you could just drag out that divorce decree a little longer. But then she came back and said, oh, I made more money anyway. So she felt better. And importantly, just a moment, importantly and super important, There is no conversation between the exes. You don't call Dan, it's your ex-husband, and say, hey, honey, I thought I'd claim on your benefit. I'm gonna screw you. There's none of that. Totally personal between you and the SSA. Your ex will never know. It's not like he gets a warning or a notice saying, oh, Marcia went in and claimed. No, there's none of that. This is completely private. It is a calculated benefit. All of this is baked in. Remember that first slide? It's for the lower earners retirement, fairness for all. This is a fairness consideration. Now, what if you become a surviving spouse? So here you go, Jeff. Here, I'm going to kill Dan. So let's pay attention now. So Dan has to die in my examples because otherwise I'd have to stop speaking now. If Dan is the higher earner and he dies first, I step into his shoes. So if he was getting $2,000 a month and I got my half at $1,000, when he dies, I lose my $1,000, but I get his $2,000. So you always get the single highest benefit for which you're entitled. And upon the death of the first spouse, it's whichever benefit is the higher. And the higher earner dies first. But what if your ex-spouse dies? Same rules. You step into your ex's. Now, you had to meet all those same rules. The only difference is you could be remarried, but only when you're older, when it's after age 60. Yes, ma'am.
That's exactly what happened to my mother.
Yes.
My late mother, she had my father's ex, but the only issue I have, and this might be something that you might look at in the future, is that not only did my mother get my father's social, so did the second one.
Yeah, so the question around, or the comment around divorces, this happened to this lady's mom in the back, of ex-husband. She met all the rules, so she stepped into his shoes when he died. But the question, I'm going to go back to my fairness comment. It's like, but dang it, his second wife also got his full benefit. Yes, she did. They created a second economic union, and she is not to be screwed. You don't have to feel good about it. Mom doesn't have to feel good about it, but she is entitled to that benefit after a year of marriage. So multiple people, and again, it's baked into how all these calculations work. It's baked in that there might be multiple beneficiaries off of the same record. Children also benefit from this. Minor children, if Dan had died when our girls were young, were in high school or younger, I would have gotten a surviving mother benefit because I'm raising our kids, and each of the girls would have gotten a benefit. We all think that's a good thing. Like, oh, thank goodness the kids are protected. But we really don't like to give any kind of credit to that second wife or second husband, that they are also entitled. Nothing happens to the worker's record. He does not get any reduction. He doesn't get any penalty for having multiple people claiming on the same work record, just in the math. Now, also, when you become an ex, so if Dan dies between now and 70, I can claim as early as, well, I'll be 62, so as early as starting age 60, and you can get your survivor benefits reduced, but claim them first, and then switch to your own at either your full retirement age or age 70. So I build these timelines for my widows and widowers to see when do you get how much at what age, so that we can have a strategy for when should you claim survivor benefits, don't leave them on the table, and when do you get your highest benefit. So sometimes you claim survivor benefit first, then your own. Other times it's the other way. Reduce your own benefit and start claiming that today, and then get the survivor benefit at full retirement age. So there's a real strategy that goes behind this. And this is something you would work with Chris and Jeff and the team on, because SSA doesn't know. The only thing the agent can tell you is this day that you call or visit with them, that you would get this amount here or that amount there. They can't help you strategize any of this. So make sure you're working with your advisor on that. Now, what if you didn't fit those three categories? You're not a spouse, you're not an ex-spouse, and you're not a widow or widower. Now what? Well, you're an individual worker. So everything is super important, the decisions you make, because there are no other shoulders for you to stand on. This is your income, your benefit, and you have to make your own plan work for you as an individual. So you want it to be the best possible. And the basic calculation applies. If you claim early, you've locked yourself into a whole lot less money per month. Now, surprises. Social Security is nothing if not filled with these surprises. You're going to avoid some of the surprises first and foremost by making sure you have your current statement. So you get that by going to NSSA.gov and you set up your My Social Security account, is what they call it. And make sure you do that if you haven't already. Go in today, that's your one homework assignment for today. Go in and make sure your Social Security number is attached to you. Make sure your birthday is correct. Someone called me last week saying, oh my God, my birthday is off by a day. Well, yeah, you know what, for all of us boomers, this is pre-computer era, right? So it was very easy to take that card, you know, from the hospital, your birth certificate, and mix up numbers. Make sure your information is correct. Attach you to your SSN so no one else does in the cybercrime world. This is how you do it. NSSA.gov, right on the home page, open your My Social Security account. You will see your statement, but it doesn't show you your 35 years anymore of your earnings history. So then you have to go to the second tab that says, see your complete earnings history, and make sure you download that page as well. And these are documents and tools that are really helpful to review with your financial advisor. So you don't have to just pour through it. They'll help you figure out best strategies and how the numbers work and what would be best for you. So grab that, download them into PDF, and then print them. Taxation, always a popular topic, isn't it, Chris? Everyone loves to hear that the taxes they've been paying into Social Security get taxed, both going in and going out. Yeah, they do. And it's a quirky formula, as so many of these tax rules are. So what happens is there's a worksheet you're going to fill out every year, or your accountant will fill out, whoever does your taxes. And they take a look at your adjusted gross income for the year. They add back in any non-taxable, any muni bond interest, which was much higher this past year than in prior years. And then they're going to take half your Social Security benefits to get a number. There's no taxation yet. This is what we call combined income or provisional income. It's a number that goes into a worksheet. Because what you're figuring out is 1/2 of your Social Security benefit going to come in as income, as taxable income, or somewhere between 50% and 85% coming in as income. And that is based on this combined income threshold. So if you are a single filer and you have combined income greater than only $34,000, up to 85% of your Social Security gross income comes onto the front of your 1040. If you're married filing jointly, it's 44,000. These numbers were set back in 1983. They've never gone up. Yeah, so they are really low for a lot of people. You saved a lot in an IRA, you've got big required minimum distributions, you have a big pension or whatnot. It is super easy to bump up over these thresholds, and you will pay tax on your Social Security benefits. And it changes every year, so you redo this every year. So my tip for you is download form W4V once you are selecting Social Security. And here you can check a box, how much do you want withheld for taxes? You're gonna have to pay them anyway. You may as well not get hit in April. Actually, in January, when you're making up and doing your quarterlies. And IRS Pub 915 is the Social Security publication. It is big and a little intimidating, but it's actually written really well. It is quite English, and the worksheet is in there so you can see how this works. Now, working and claiming, here we always have a problem when people want to claim Social Security benefits, but early, but they want to keep working and making a lot of money. Because, you know, again, it's going bankrupt and all. So I better grab mine while I can. Don't do that. Because if you do that, you're actually not going to get any Social Security money. So there's this concept of withheld benefits. The only time you get Social Security monthly benefits is when you're retired or deemed retired. Well, if you claim at 62, 3, 4, 5, and 6 for most of us, you're younger than full retirement age for the entire year. And so now you are not retired, you are not at full retirement age. So if you're working, making more than $21,000 for the year, don't raise your hand again, but just think in your head, do I make more than $21,000 in a year? Yeah, that was a yes from everybody, pretty much. So if you make more than that, while you can technically claim, you're going to have a whole bunch of withholdings. Any amount you make over 21,000, you will not get income for the month, or 2, or 3, or all 12 months. So now you've gone in, you've claimed early, you've locked in a reduced benefit, and you don't get any money. Doesn't really seem like a bargain, does it? This is not a strategy that works. Now, the year you reach full retirement age, it's a little different. You can make all the way up to $56,000 this year. And this helps people who are retired. A lot of people retire June 30th, for example. So fine, you can make up to $56,000 and you could have claimed starting in January and you wouldn't have gotten a clawback. But anytime you're working and younger than full retirement age, you're not going to get all the money you think you're going to get. But that changes the month you reach full retirement age. Now you can work all you want. You can earn any amount of money per month and per year, and no benefits are withheld. So if you were entitled to $2,000 a month at your full retirement age, you get your $1 million a month from working and your $2,000 a month. So you're set here, but you have to wait until full retirement age for the work thing to work. This money doesn't go away forever. Every December, every November, your benefits are recalculated. And for the months that you weren't paid, you will have those months put back into your calculation. So they will increase your ultimate claiming amount. So it's not as reduced, but it's just a little ugly. You have questions, sir?
You answered.
Okay, yeah, so you don't lose them forever. You just lose them temporarily until full retirement age. Another big surprise for most people is, and Susan's gonna cover this in much greater detail about this incredible program called Medicare. Medicare is part of the Social Security law. And because of that, Social Security, the administration, is tasked with monitoring and managing and administering both Social Security and Part B of Medicare. So your Part B premiums are going to be automatically deducted right out of your Social Security checks before the deposit is made, once you have both programs fired up. So if you thought you were getting $2,000 a month and that's what you're building your cash flow on, don't do that, because you're not getting $2,000 a month. You're getting $2,000 a month minus your Part B premium. And this year that starts at $164.90 per person. So if you're married, you get hit with that number, your spouse gets hit with that number, and both of your Social Security payments are reduced. All right, so keep that in mind. Your statements don't reflect this. That's part of the problem with the statements. We just see what our potential is based on our highest 35 years of work history. And so it's a good starting point, but do not use that in the cash flow projections. It's the wrong number. And my tip for you here, and Susan, I don't know if you have the same tip, is order a paper copy of the Medicare and You book. It's about 150, 160 pages long. Nice big type. I can read it now without my glasses on. So you see the scope of this program and what we're all moving into. It's a key piece of your education. So just make sure you pull it in. The website is your place to start, ssa.gov. Again, here you can learn all about getting ready to claim benefits and how to claim and such. Apply for both Social Security and Medicare on ssa.gov. You do not apply for Medicare on Medicare's website. I know, it's just not even reasonable. And here's where you create your My Social Security account. Yes, sir.
So, somebody's of age 66.
Is,
Somebody's of age of 66, you mentioned.
yep,
And they decided to continue working on a part-time basis. So the Social Security every year calculate that based on the fact that you're doing.
yes, the question is, if you're over your full retirement age, but you're still working, whether it's full-time or part-time, the Social Security count that every year when they recalculate your benefit? Answer is yes, but will it matter? Because if it is not, if you're working part-time or hobby time, it might not be one of your highest 35 years of earnings, but it is considered when they do the redetermination every year. So don't skip out on, a lot of part-time earnings that we're earning between say 65 and 70, they're kicking out 1970s, much lower numbers. And they will give you an extra boost, not a lot, but a little bit, to your Social Security payments. So they can be really important years, especially moms who stepped out of their careers. And they often go in, your Social Security statement will have 20 zeros. Those zeros are included in your highest 35 years of earnings if you don't have actual dollars. So part-time work kicks out a zero. Next year's part-time work kicks out another zero. It's meaningful. Other things to look for, free information. I like free stuff. I think as Chris mentioned, I do a lot of writing. I have written a blog, boomerretirementbriefs.com, for years, and have a section on Social Security. Some good examples in there and why no one will survive if Social Security goes bankrupt. I write a lot about that. So you're welcome to hop on Boomer Retirement Briefs. I've got checklists on there based on your marital filings. So are you married, single, widowed, divorced? Different checklists, and a weapon GPO one for those who are teachers. And with that, oh, look at that, I'm right on time, 44 minutes. And any last quick questions? Because otherwise, I'm gonna turn things over to Chris, and then we'll answer all your questions at the end. Yes, sir.
I was told that it's better for husband's older, what's years younger, for the wife to take Social Security earlier.
So the question is, and I always love this, so thank you for phrasing it this way. I was told, by my neighbor across the fence or my cousin, all my other experts in Social Security, that a lower earning younger wife should claim early. And the answer is maybe. It depends on a whole lot of factors. The industry, all the financial advisors that we work with too, they want these simple rules of thumb. And the rule of thumb is maybe. You just cannot make this decision in a vacuum. It very often does work out that way, but do you have $1 million sitting over here so that you can fuel the rest of the household need with your savings? And is that what you want to do? Is she working? Will she work part-time? I don't know. We have many questions to ask first, but it is a great question. It's something we hear all the time. So thank you. All right, I'll be back later. Chris, thank you so much.
Yeah, we'll definitely have an opportunity for more questions as we go through. That was something I meant to start us off with. We built a little bit of time at the end, so feel free to jot down any additional questions that occur to you as we go through the presentation. It's fine to ask some questions as well, as we mentioned. It's livens it up, makes it more relevant to you, so that's good. But if we get too many, we'll just tell you we gotta wait till the end, so that's fine. One of the things that was mentioned was this question of when do we turn it on, and Marcia made the point that sometimes retirement date and Social Security turning on that date, these don't always have to be the same. One can retire potentially before they decide to turn on their Social Security. It's just a matter of how do I fund that period of time, my cash flow demands, and that can be different for everyone. So we're going to talk a little bit about that briefly. Our presentation today for our clients, what I'm going to go through may be familiar to you already. For those who are not clients, our presentation is complimentary. We're glad everyone's here. So I want to also just mention another complimentary opportunity to you, which is to have a sit down with us. And we are provide both financial planning and portfolio management services. And so one of the things we're going to offer is just to come on in, talk, sit down, and we'll see if we can be a resource to you in helping to figure out some of these important decisions. Social Security is one of, and Medicare is one of these important decisions that you'll have to deal with and how to navigate. But there's a lot more that goes into plotting out your roadmap for retirement. And so perhaps some help along the way can be useful. So with that in mind, what I want to really reference here is just people come in oftentimes talking about investments. They're focused on investments. This crowd, that may not be the case because you're focused on planning with Social Security and so forth. But it's important to us as a firm, we think about the context. How does it all fit together? We want to look at, it's not just about one aspect of this, in this case, the investments or Social Security or whatever it may be. It's about a complex set of changing issues for each person's circumstances. So I want to look at how they all fit together, put together a useful financial plan. We call it 360 financial planning, to look at kind of from all angles. How does it fit together? Okay. And let that inform how we think about some of these decisions. And, you know, this is just an illustration we put up. One of the tools that we use, our resources in our name is asset management resources. Well, we're about resources. One of them is a great tool that we have that's helpful in thinking about our financial planning. And whether it's thinking about Social Security and when do I turn it on? What if I do this? What if I do that? What's the best way to do it? How long does it take me to catch up if I start it later than start it sooner? You know, we've got some resources that make it very useful to have the conversations around what if this, what if that, what are the changing dynamics? Okay, so whether it's what if I work another year longer? What if we do the Monte Carlo, these numbers up here that we're talking about, the probabilities. This is a Monte Carlo simulation, or maybe our mean, our midpoint, but there's probabilities of success that can vary because of what's going to happen with different market dynamics. This is again, Social Security. Well, if I delay, how long does it take me to catch up? We don't like to use the term delay if we optimize. But it's essentially that issue. What happens? How long does it take for me to be able to catch up and then benefit from that decision? There's lots of variables that can go into it, whether it's thinking about your portfolio, or even when we come into doing this, we can have the opportunity to have you link accounts so that things will be imported directly if it's easier and faster for data gathering. There's some great resources that we have in this program. It's only one of the many programs we use and invest in providing our clients useful resources and thinking about how to be best prepared for what's to come in the years ahead. You know, we do some stress testing as well. What if I die too soon? What if I live too long? I mean, what's that mean? You know, obviously, I don't live too long. But the idea, we don't want to run out of money before we run out of breath. What if we have long-term care costs? Can we self-manage those with our resources? Or are there choices we should be entertaining, whether it affects our estate planning or our insurance planning? You know, there's various ways to think about it. So in any case, what we want to do is invite you to come in for a consultation, talk about your particular circumstances. I'll mention at the end that you know, how this will work out for cost, but basically we charge something for the time. If you end up working with us as a portfolio management client, we'll waive some of that cost. And for people who decide to take advantage to sign up for a meeting today, we'll give you a 10% discount on the financial planning costs. You can come in as well and just have a financial plan if you decide, yeah, I'm happy with my own portfolio. I just want some help in navigating some of these issues. That's fine too. We're happy to work with you on the planning issues that are important to you. Okay. So in any case, when it comes to our portfolio services, we also do talk about our portfolio design approach. We call it active allocation. The idea that, you know, yes, we're focused on investments from an asset allocation perspective. How much we put into which buckets affects risk and return. So we're mindful of that, but we also think there's some value to be added by being attentive to what's happening in the economy, what's happening with the Fed and interest rates and inflation and all that. We can make some adjustments in the way we position our portfolio that can add a little bit of value, and hopefully it overcomes the cost that we have, in addition to providing all the financial planning value that we provide as well. So in any case, for people, most of our clients, we use funds, mutual funds and ETFs. But for some people who are more oriented toward individual securities, we can work with you with a stock strategy as well. So it's a matter of preference as to what's appropriate for you. In any case, yeah, this is sort of that notion that there's all kinds of things to be paying attention to. And, we find a lot of times that whether it's on the individual level of, can we improve on some of the investment selections, whether it's individual positions, find a lot of the common concerns. Sometimes people have too much in an individual name because they worked in an industry, or they have maybe too much in a particular industry because they have an affinity for that. Sometimes we can find that people have issues of cost that's built into their selections that they didn't realize. Sometimes it's a matter of just not knowing how to evaluate what's happening in the world around us and how does that affect our strategies. There's so many things to be thinking about as an individual that can be difficult to do on your own. And so there can be help and value by working with someone else. There's a Vanguard study that indicated that a good financial advisor, because of looking at a range of possible things, can add as much as 3% in value annually. Though it doesn't happen annually, it happens in chunks. A lot of times that's because of behavioral coaching. Sometimes we want to do the wrong thing at the wrong time, right? Market's going great, let's get more. Oh my gosh, the market's gone down, let me get out. So there's cost to working with someone, but there's also a great deal of value. And so in any case, we want to invite you to take advantage of that. That's the extent of our commercial for you. So if you take advantage of it, feel free. We're going to have an evaluation at the end. You can indicate you'd like to have a conversation, or at the end of our presentation, schedule a meeting if you'd like to, even today. Okay, so with that, let's get on with our presentation. We're going to talk about Medicare next. And as you heard, great presentation from Marcia, synthesizing what's really kind of complex stuff. You're gonna find the same thing with Susan. Thank you, Susan. Here you go. All right.
Thank you, Chris. Thank you, Jeff, Kristen, for having me. I appreciate this opportunity. I always hate going after Social Security, especially Marcia. Everybody loves to hear about thinking about retiring and your money. Medicare, not so much. It's not as exciting. And the presentation I'm going to do, it is a pretty detailed presentation. So what I do like to do is I like to go really through one topic at a time. I'm going to stop, see if we have any questions. Again, not an overload of questions. We can always do that at the end. But the information really builds off of one another. And I think it's important that before we move on, that information is understood. If you ask me a question I know we're going to get to, I don't mean to say we're going to get to it. I just want to be cognizant of the time, make sure everybody leaves here with a really organized presentation. So the first section that we're going to go through is all about Medicare and the Medicare related options. I always say there's good news and bad news here. So the good news with the Medicare section is that usually once you go on to Medicare and you pick a plan, there is a plan that's going to meet everybody's needs. So most people are happy with their Medicare plan once you go through all the work of finding one. And if you're not happy with it in years to come, or when you first go on, just know you're on the wrong plan, because we'll go through. There's usually a plan that will meet everybody's needs. The bad news is, as I said, there's a lot of options out there, so it's a lot of work to kind of sort through that, and that's what we'll do here today. The second section, you might say, well, I'm going to retire at 63, and maybe you can. You're working with Chris or Jeff, and that makes sense. But unfortunately for your health care during that time, it is a very expensive time period for your health plan. So this section is going to be super quick. We're going to talk about it maybe for just a couple minutes. Because it's not a lot of options. So that's the good news. The bad news is that it is an expensive time for a lot of people. So we'll start with Medicare. And this slide right here is a slide I'm going to refer to throughout the presentation. Probably even go back to this slide a few times. But what it's showing you here is that Medicare is always your starting point. So once you go on to Medicare, that's your starting point. You could stop there and do nothing else. A very oversimplification of Medicare is that it's an 80-20 plan. Medicare covers you 80%, you pay 20%, there's some deductibles, go to any doctor, any hospital that takes Medicare, and most do. So you could stop right there, but most people want more coverage than Medicare. So the first thing that you always want to do is if you're working and you're leaving that employer, you want to ask, do I have retiree coverage for my medical when I leave here? If you do, you're usually choosing the plan through your employer. So some people, you work for the federal government, city, town, you might want to make sure you're not leaving a benefit on the table. But for most people, they're going to have to buy insurance on their own. And if you do, there's two distinct pathways for you to go down. And neither is better than the other. It's just a weights of balance that you need to look at. The first pathway we'll talk about here today are called Medicare supplement plans. These are plans that are going to pick up that 20% that Medicare left behind. They're not going to add in a lot of extras that Medicare doesn't cover. So you're not going to see your money towards your glasses, dental cleaning, and you're also going to need to buy a separate prescription drug plan. When you look at this pathway, I typically say that's going to be the most expensive monthly premium pathway that you have for the least amount of money as you see those doctors in those hospitals. So that's one way, and we're going to take each one of these boxes really one at a time and go through it. The other pathway, the Medicare Advantage plans. These are your HMOs, your PPOs. These are the ones you're seeing on TV. William Shatner, Joe Namath, zero premium. Has everybody seen those commercials? So these are those. And we're going to talk about how these plans work, how they're funded, because a lot of times people say, well, how can you get something for nothing? So we'll talk about that. But when you think about these plans, what you want to think about is lower monthly premium, extras that Medicare does not cover, but you're paying costs as you go. So every time you see a doctor or hospital, you probably have some type of cost along the way. So again, it's a weights and balance. But we're going to start with Medicare because what we find is that if you understand Medicare, everything else makes a lot more sense. So Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Part B. Part A is premium free, paid into the system if you paid into the system. Part B, Marcia mentioned, $164.90 per person per month. If you're collecting Social Security, it's going to come automatically out of your Social Security check. Again, Chris and Marcia mentioned, you don't have to take Social Security and Medicare at the same time. So, you know, Medicare age 65, maybe you're not going to collect till you're 67. But the key here is that if you are collecting, they're taking that premium out of your Social Security check. And if you are in a higher income bracket, I believe it's 97,000 as an individual, 194,000 as a married couple. I have a resource slide in the back. You can always work with Chris and Jeff on that as well. But based on your income at that point, Medicare premiums start to go up. And so Medicare A is your hospitalization and your skilled nursing. And when you think about hospitalization, what you want to think about is the room and board, the lab, the equipment, everything you're doing in that hospital minus your doctor care. So doctor care actually falls under Medicare Part B. Part B is all of your doctor care, whether you're in or out of the hospital, and then all of your outpatient services, your labs, your x-rays, MRIs. Maybe you're going into a hospital setting for that MRI, but if you're not admitted, it's still Medicare Part B. And then, as I said, with Medicare, any doctor, any hospital that takes Medicare, most do, no referral. You want to see a doctor in California, Connecticut, Massachusetts, you want to see a cardiologist, dermatologist, makes no difference. So lots of freedom of choice with Medicare. So we're gonna look a little bit deeper into Medicare. But first question we're gonna do is when and how to enroll into Medicare. Because I think we've all mentioned already that somebody's gonna tell you something. So as long as you're turning 65, somebody's gonna say, oh, you have to take Medicare. And that may or may not be true, really depending on your personal situation. And what we find is that most people will find themselves in one of the next 3 categories that I'll go through. And again, you can always call Social Security for more information. But the first category would be if you're turning 65 and you're already collecting Social Security, then you should expect to see your Medicare card come automatically to you about 2 to 3 months prior to your 65th birthday. So let's say you were born September 20th. You're not yet 65, but your Medicare would start September 1st, and that card would come a few months prior. With Medicare, with everything, there's always an exception to the rule. If you were born on the 1st of the month, let's say you were born on September 1st, for some reason, Medicare starts you the 1st of the previous month. So you would start August 1st, and again, see that card come a few months prior. So nice and easy, if you want your Medicare to begin and you're collecting, it's going to come automatically to you. But if you're turning 65 and you're not collecting Social Security, nothing happens automatically. So you do need to initiate that process if you want it. And again, you'd want to do that about 2 to 3 months prior. So it starts the first day of the month of your 65th birthday. You have the month of and 3 months after, that's called your initial election period to sign off. But most people are going to want it on the first day of the month of their 65th birthday. If you do it later, there's going to be a delay. And then this is where it really starts to get tricky, or where we start to see the questions. Well, what if I'm going to work past age 65? And whether or not you take Medicare really is going to depend on the size of your employer. So we all heard about the penalties if you don't take Medicare when you're initially eligible to do so. But working past age 65, you can delay signing up for Medicare past age 65 with no penalty, as long as you or you have group insurance from an employer with 20 or more employees from whom you or your spouse are actively working. I kind of say that in that tone because I want you to know that the actively working portion is important. So let's take an example here. You work at a hospital, well over 20 employees. You have the health insurance through that hospital. When you turn 65, if you say, I'm going to continue to work at this hospital, I'm going to continue to have this insurance through that hospital, you really don't need to do anything. You don't have to sign up for A, you don't have to sign up for B. Because if you more than 20 employees, your employer plan is your primary insurance. It's always going to pay first. Some people are going to say, well, I want to sign up. I heard I need to sign up for A. A is premium free. So you can sign up for A. If you end up in a hospital setting because you're admitted to the hospital, your employer plan is still going to pay first, but there may be some coordination with that Part A. You don't want to sign up for Medicare Part B if you're working past age 65 because you don't want to pay that premium. You don't want to be paying that $164.90 for nothing. So yes, sometimes you're working past age 65, you might sign up for Part A. You don't have to, there's no penalties. When you retire, or you know when you're going to retire, you're going to call, go online, my Social Security, go down to Social Security, make an appointment, say, I need to sign up for my Medicare Part B or my Medicare A and B at that time. They're going to say, well, where were you? You're going to say, I was actively working with insurance for my employer. They'll give you a form for that employer to fill out, and you'll be able to go on to Medicare without any penalty. Now, if you're working at an employer with under 20 employees, the rules are different. Most likely, you're going to need to take Medicare A and B at that time. And the last thing I want to mention here is that if you do work past age 65 and you have a high deductible plan, and it's paired with what they call an HSA, and again, Jeff and Chris would know all about this, but you're taking the pre-tax dollars out to fund that high deductible plan, you're not allowed to be on any different medical plan than that high deductible plan. So what will happen is you don't want to sign up for that Part A, which is free, because you cannot contribute to an HSA and be on any other medical plan besides that high deductible plan. So in that example that I gave, working past age 65, if you have a high deductible plan, you don't want to sign up for Part A if you want to continue to contribute to that high deductible plan. And you want to be aware that when you go to sign up for Medicare, let's say you pick a retirement date of October 1st. But keep in mind, Medicare will always start the first of the month you're retiring. It's never going to start October 15th or October 30th for you. So let's say you pick that October 1st date and you worked until you're 70. Medicare is going to say, okay, we're going to start your Medicare Part B on October 1st, but they backdate the Part A 6 months. So you want to be aware of those, that HSA and that high deductible plan. And so that's why Medicare typically recommends you stop contributing to an HSA 6 months prior to going on to Medicare if you're working past age 65. So I am going to go through 2 more slides on just Medicare alone, and then I'll stop and see if there's any questions. So Marcia mentioned that big Medicare unique booklet. That you definitely should get that before you go on to Medicare. It gives you all that information, and then it will come out every October. Every year you'll get a new Medicare unique booklet. It will go over everything that I just went through and go into detail. So, but just a quick overview. Let's say you only have Medicare and you went into the hospital. Medicare is going to cover you your first 60 days in that hospital after you paid an initial deductible of $1,600. So whether you're in the hospital 1 day or 60 days, it's not going to matter. When you left that hospital, you'd eventually get a bill for $1,600. If you're ever in the hospital more than 60 days, you start to pay $400 a day on day 61. In the hospital at day 91, you start to pay $800 a day. Also under Medicare Part A is what we call the skilled nursing facility. You do need to be admitted 3 days prior in a hospital for that benefit, but then Medicare will cover you the first 20 days at 100%, and day 21 through day 100, you would pay $200 a day. So that's that Part A, that premium free. So, and just to mention here, Medicare Part A works off of what they call a benefit period. A benefit period begins the day that you enter that facility, and when you've been out for 60 consecutive days. So it is possible you could pay that $1,600 more than once a year. An example would be, let's say you went into the hospital on the 1st of the month, left on the 10th of the month, you're going to get that bill for $1,600. You go home for a few days and you go back into that hospital, you're not going to pay that deductible again. They simply pick up where you left off, day 11, day 12, day 13. But in that same example, if you go home for 4 or 5 months and you go back in, it's a whole new benefit period, new admission, day 1, day 2, and that's how you would pay that deductible. And then Medicare Part B, a lot easier to understand. Part B, again, is all of your doctor care, outpatient services. It has a calendar year deductible. In 2023, it's $226. So let's say you went to the doctor first time when you're Medicare. The doctor charges $500. You'd eventually get that bill of $226. That would be your medical deductible. Once you've met it, you met it for the year. You're never going to pay it again. And then again, Medicare is essentially an 80-20 plan after that. Medicare covers you 80%, you pay 20%. It does not cover the prescriptions. That's Medicare Part D or outpatient prescriptions. We'll talk about that in a little bit. It covers you anywhere in the US and our territories, but not worldwide. So it doesn't add in that routine hearing or dental. So that's a very quick rundown of Medicare. I told you it's pretty detailed. So any questions? Sure.
What happens if you are out of the country?
What happens if you're traveling outside the country? So if you only had Medicare, you would be paying whatever cost out of your own pocket for that. When we talk about the insurances coming up, those plans will typically have some coverage for outside the US.
Is it true that the coverage at a skilled nursing facility is if you can improve and you're getting physical therapy?
Yes.
It's not if you're going down with the wrong people.
You've got it. Great question. So her question is really, what is skilled nursing care? So when we look at this skilled nursing care, we see the first 20 days and then day 21 through day 100. It doesn't mean that you're entitled to 100 days. Skilled care is really, an example might be, you go into the hospital, maybe you broke your hip, maybe something, you had pneumonia, not ready to get up and walk around. You're gonna go to a skilled nursing facility for them to get you back up on your feet. And now, let's say that person that went to skilled nursing, unfortunately, they have Alzheimer's, or they have something that, you know, maybe it's a better spot for them to be. But if it's not medically improving them or getting them back up on their feet, then that's going to be more long-term care insurance, and Medicare nor health plans are going to cover that. A great question. Yeah.
So my husband's still working. We're over 65 and we're not collecting Social Security. But we pay significantly for health insurance because it's his company. You know, we have more than 20 employees. It sounds to me like income levels and stuff, it might not be worth it to go on Medicare, even though we can. We were staying off of it because we had a 24-year-old daughter, but now she's going to be taking it from there.
Yeah.
Is it just a calculation?
Yeah, so here's a question. This is a great question. So for most people, when we're talking about if you're working over age 65, you're gonna continue to use your employer plan. The employer is paying that premium. If you're the owner of the company, you're paying the premium. There's a couple different things that you're gonna think about, and I wouldn't be the expert to advise you because then it becomes a math equation, and you're talking to an advisor, you're talking to tax accountants on that. A great question.
Along the same lines, that you're over 65 and enroll in Part A, what is the advantage? Will they pick up any pay? You know, after your employees insurance, if you're in the hospital?
So Part A, is there a benefit to pick up Part A? Part A is always going to depend on your employer plan, because your employer plan is going to pay first. So maybe somebody will get a benefit from Part A, maybe somebody won't. If you don't have a high deductible plan, doesn't hurt to take it because it's free. So, and then you're in the system, but if you have a high deductible plan, you're not going to take it. So.
Right, but will they pay, say it's an 80-20, and as far as what they pay in benefits for your care while you're there?
Great.
Do you have to pay 20%? Does Medicare pick up that?
So Part A is really just the hospital, room and board, lab equipment.
Yep.
It's not the doctor care. So that, to pick up the 20%, that would be that Part B where you're paying that $164.90. So you would never take Part B while you're continuing to work and pay that, because it's not going to pick up those co-payments or cost share for you.
Well, I'm talking more about when you're actually in the hospital.
When you're actually in the hospital, it's going to be right here.
Right.
And so let's say you have a $3,000 deductible on your health plan,
Right.
and then you have Medicare Part A, there should be some coordination of benefits.
Okay, there will be, okay.
All right, so thank you. So you could stop right there, and we'll take some more questions at the end. You could stop right there, do nothing else. But if you say, well, I want more coverage than Medicare, the first pathway you can start to go down are called Medigap or Medicare Supplement Plan. So earlier I called it a Medicare Supplement Plan. Now you see on this slide it says Medigap, just really to keep you awake, because what will happen is when you actually do look up this information and you do some research, those two terms are interchangeably all the time. They mean exactly the same thing. They're a type of private insurance that you're buying that fills in the gaps or supplements where Medicare left off. So these plans are picking up that 20% that Medicare left behind. You're buying them from a private insurance company like Blue Cross, like another carrier. What they're gonna do is that when you buy one of these plans, Medicare is your primary insurance. Medicare's always paying first. The health plan is there that you bought just to wait for Medicare to pay and pick up that leftover amount. So in Massachusetts, they're regulated by the Division of Insurance. We have 3 standardized plans that we'll see. Each one of them, again, is going to pick up that 20%. So kind of an oversimplification, you go to the doctor, you show 2 cards. You show your Medicare card, your health plan card. Doctor bills Medicare. Medicare pays its share. Whatever's left over goes back to the doctor. If you didn't have health insurance, they bill you the leftover amount. You have health insurance, they're billing the health insurance that leftover amount. Like just for that concept, Medicare's paying first, health plan's paying second. So the health plan, let's say you chose Blue Cross, you chose somebody else, and you call and you say, who's your provider directory booklet? There's no provider directory booklet. It's Medicare. Any doctor, any hospital, it takes Medicare. What's the benefits? Whatever Medicare would have covered, that health plan, they're gonna have regulated benefits where they pick up where Medicare left off. But all of these plans are gonna pick up the 20%. If you're retiring in another state, they work on a different concept is always gonna be the same. Medicare pays first, health plan pays second, but it's gonna be like A through N type of options, and we'll see that as well. So key points, Medicare is primary, any doctor, any hospital, it takes Medicare, no referral, so lots of freedom of choice. You get to use Medicare the way it was set up, but they're not gonna add in a lot of extras that Medicare doesn't cover, like money towards your glasses, dental cleanings. You're still buying your separate drug plan, because again, the concept is that the health plans bring you enough money every month from their membership to simply pick up where Medicare left off. The mini gap plans in Massachusetts, they're called Supplement Core, Supplement 1A, and Supplement 1. And one common thing you need to know is that there's no more family plans, so everything's individualized. So each one of these plans you could buy from a different carrier. In every carrier, even though these are regulated benefits, you'll never have less than what's on the screen. They all have different memberships, so they're going to have a different premium. So I'm just going to give you an average kind of starting point for those premiums. So for the Supplement Core plan, you want to think about $130 starting per person per month. Supplement 1A, probably around $190 per person per month. And the Supplement 1 around $230 per person per month. Supplement 1 plan, the easiest plan to understand. All you have to do to understand that plan is to know that if Medicare covers the benefit, the Supplement 1 covers it at 100%. So the doctor, hospital, lab, x-ray, Medicare pays first, supplement pays second, no cost for you. So if you had $2 billion of medical care, your premium would be $230 times 12. That would be your out-of-pocket cost per year for those Medicare covered services. If you had zero care, it'd still be $230 times 12. So very predictable cost. The 1A plan, it's almost the same as the Supplement 1 plan with one exception. Every year you would pay the Part B deductible. So this year, the Part B deductible is $226. So again, very predictable cost. You're gonna do, let's say 190 times 12, plus you're gonna pay your first $226 of your medical care every year. And that's your out-of-pocket cost, no matter what happens. You might say, well, that's a lot of money. I haven't even been in the hospital in 30 years. I've gone to the doctor once. You can look at the Supplement 4 plan. That's $130 a month. For your doctor care and your outpatient services, you'll pay that Part B deductible. And then after that, every time you have a doctor, lab, x-ray, everything's covered at 100%. The difference, you're paying a lower premium. You're going to pay the hospital deductible if you end up in the hospital. then you paid skilled nursing at day 21 if you're there. It's almost like think about your car insurance. None of these are better than the other. It's just I want to pay a higher premium, have no deductible, or a lower premium to have some deductible. Right here, you'll see the supplement 1 plan. Those plans you needed to be eligible for Medicare prior to 1/1/2020. So what does that mean? You didn't have to be on Medicare, but you had to be 65 or eligible for Medicare prior to 1/2020. So if you say, I'm just turning 65 right now, or coming up, you're really just choosing between the core and the supplement 1 for these types of plans. These plans in Massachusetts have continuous open enrollment, so there's a lot of flexibility. There's no pre-existing conditions, and whatever plan you're buying, that premium is for the group. It's not based on your health or your age. You're gonna just move your eyes to the bottom of the page. You can see that they don't have prescription drug coverage, so you do need prescriptions with these plans. Medicare only covers you in the US and our territories. So supplement 1A and the 1, that's an exception to the rule. They do cover you outside the US. Typically, you're gonna have to pay upfront first, then come back and be reimbursed, where inside the US, there's really no claim form. At Blue Cross, we do cover you worldwide on the core. I don't have a check mark there because I want you to know what the regulated benefits are. You'll never have less than what's on this slide, but many of the carriers will cover you worldwide on that core plan. So any doctor, any hospital takes Medicare, no referral, premiums ranging from $130 starting to $230, picking up where Medicare left off. If you were in another state, you're going to have the same type of portfolio, A through N. Not every state will have all of these letters, but it will be the same concept. Medicare pays first, health plan pays second. You're looking at that premium, but what you do want to know is in other states, it's probably not continuous open enrollment. There's different rules that go along with it. And there's different underwriting guidelines, so not as flexible as Massachusetts. Any questions on the Medigap plan? Yep. So next we're going to talk about the prescription drug coverage. So Medicare Part D. When we talk about Medicare A and B, and we talk about going to Social Security, a lot of times people coming into this process will say, okay, I'll just sign up for Medicare Part D through Social Security. Well, you can sign up for a D plan, but there is no such thing as just give me Medicare Part D. Part D is always through a private insurance company, and what that Part D plan, what the cost of that Part D plan is what the company is charging for their monthly premium. All Part D plans will follow the same levels of coverage. Again, there's a standardization, but what will be different from company to company will be which drugs that they cover on their formulary, the co-payments that you pay for those medications, the pharmacy network, and again, the premium. You could call a whole bunch of different companies to check your medications, but you don't want to do that. There's a whole computer system there that you can go into Medicare.gov, and I'll have some other resources. You put in your medication, and they're going to help you choose the best Part D plan that covers your medication. Because these Part D plans, they can range anywhere from the single digits to over $100-something. Average premium is about $30-something a month. But it doesn't matter. If you take medications, you want to find a plan that covers your medication, that you're going to pay the least amount of money out of your pocket and premium and copay. And that plan finder will help you do that. So it doesn't really matter if you're paying $20 a month or $50 a month for your monthly premium. Again, you want to make sure that you're in a plan that's covering your medication. You're paying the least amount of money, copay and premium. Some people are going to say, well, I don't take any medication, so do I have to take it? And the answer is you never have to take a Part D plan. And if you never join one, you'll never be penalized. But if you don't have what the government calls creditable coverage, prescription drug coverage as good or better than a Part D plan, and you don't take it, say you go on to Medicare, you take a supplement, you say, I'm gonna wait until I need a Part D plan, that's how you get that late enrollment penalty. You're still working past age 65, most likely your coverage is creditable for your employer. You don't have to take a Part D plan. You have the VA, you don't have to take a Part D plan. But more Medicare, I'll wait until I need it. I'm on a Medicare supplement, I'll wait until I need it. That's how people run into those penalties. I think the biggest really change for people when they leave employer coverage is the drug coverage portion. Because right now, if you're still working, you're probably going to a pharmacy and you spend $10 or whatever your copay is to take home your medication. And the actual cost of that medication doesn't matter. So you might say, I pay $10, but is the medication $50 or $500? What's that insurer paying? Once you go onto a Part D plan, what's going to happen is they're going to give you a set amount of money every calendar year towards the total cost of your medication. So in 2023, that total cost was $4,660. So you can almost think about it like a debit card. You have this $4,660. You go into your pharmacy, let's say you took a Part D plan and you look up your medication, and on their formulary, it says the copay is $10. So you go in, you pay the $10, but the pharmacist charged $100 for that medication. You paid 10, the Part D plan paid 90. They're subtracting the full $100 from 4,660. Now you have 4,560 left to spend. So every time you pick up that medication, they're debiting down the total cost of the medication. And if you say, well, I only have a high blood pressure medication, it's $1,000 a year. It's not going to feel much different to you. You're under that 4,660, you're just paying copays. But if you say, I have $5,000, $6,000 worth of medication, eventually you'll use up that money and you'll enter what they call the coverage gap. And at that point in time, you start to pay 25% of the cost of your medication. So if your medication is $100, you're paying, plan's paying 75, you're paying 25, a little bit more behind it, but you're paying 25% of the cost. And that just continues on until the end of the calendar year, then you get a new allotment of money. Or it continues on until you hit this catastrophic coverage. And the catastrophic coverage is reached by what you pay for your copayment, what you're paying in the coverage gap, and if you take real names, what you, the health plan, Medicare is kicking in, they're counting some of that money towards it too. And if those figures ever reach $7,450, then the plan kicks back in and covers you at 95% and you would pay 5%. So very different model really than what you have right now while you're working. But if you're under that 4,660, shouldn't feel much different. If you're over, typically you're paying that 25% with some out-of-pocket maxing in there. So where are we in here? We've done all the hard work of this presentation. I just want to kind of show you where we are. We talked about the Medicare 164.90. Then we talked about the supplement plans 130 to 230. And then we talked about the prescription drug coverage. Everybody's going to have a different scenario, but let's just say average around $35. So as I said, that's the most expensive pathway. And if you're here and you're saying, are you kidding? I didn't even know Medicare costs money. And now you're talking about supplements and Part D. I'll say hold off, because we're going to talk about the Medicare Advantage plans in a minute. And these are lower premium plans with some extras. Or you might have said, well, this is wonderful news. I've been working past age 65. I've been worried about going on to Medicare because I was worried about chemotherapy, radiation, MRI. Now, this might give you a lot of peace of mind to know that you can find just as good of medical coverage usually as your employer plan. $190, you're going to any doctor, any hospital, no copays after you pay that initial $200-something deductible. So that's why I said earlier, there is a medical plan that's going to fit everybody's needs. You just have to do the work to get there. So the next product we're gonna talk about are the Medicare Advantage plans, and these will go much quicker, because everybody's familiar with HMOs and PPOs. Sure.
Just a quick question.
Sure.
Is the Part B and the Part D insurer always the same?
So Part B is through the federal government,
Okay,
and Part
the
D,
supplement then.
so let's go here. Medicare A and D is always to the federal government.
Okay, sorry. The supplement.
Yeah, and then the supplement is always through a private insurance company like Blue Cross, like somebody else that you're paying.
So will the supplemental insurance, the Medigap and the drug provider always be the same insurer?
Good question.
Or will they be different in terms?
Great. So question is, can you have different insurers for the supplement or the Part D? And the answer is absolutely yes. So let's say you take Blue Cross for a supplement, you could take a different company for the Part D. You take Blue Cross for Part D, you could take a different company for the supplement. And even if you do the same company, you're still going to get two separate cards and two separate bills. It's the way it's set up for it. So, yeah. A great question. So now, different option, never do both one way or the other, is the Medicare Advantage plan. Again, these are those HMOs, PPOs, these are the ones you're seeing on TV all the time. How do they work? Well, somebody tell me I can get a zero premium plan. How can I get a zero premium plan? You don't get something for nothing. Well, the health plans are not funding these at zero premium. What's happening is if you join an HMO or a PPO, Medicare is sending the health plan a set amount of money every month for every member that comes off that plan. So we're getting this funding, and then you're going to send in a monthly premium if there is one. So you get the Medicare money, your money, we pool it all together. Then we contract with doctors and hospitals. We give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. So on these plans, you see the money towards glasses, dental cleaning, there's all these extras. The drug coverage is included. It's the same model that we just went through. It's just that you don't go out and buy it on your own. So all in one medical prescriptions, you need to always continue to have your Medicare and pay those premiums. Medicare is always your starting point. So you can put that Medicare card away in your house, because when you go to those doctors in those hospitals, you only show your health plan card, because they're going to build a health plan and we're going to pay those claims out of that pool of funds that we have. If you showed your Medicare card and they billed Medicare, Medicare would say, hey, we already prepaid that plan to take care of you. So similar to your work plans, it's the one card medical prescription extra. In Massachusetts, we essentially have HMOs and PPOs. HMO is a health maintenance organization. You choose a primary care doctor, and that doctor refers you on for that specialty care. PPO, preferred provider organization. You can stay in network, you have contracted providers, or you also can go to any Medicare provider, no referrals. So the PPOs give you a little bit more freedom than those HMOs. Again, one monthly premium medical extras. What you want to know is the network is a little bit different than if you're still working. So while you're working, if you had Blue Cross, another carrier, you never worried if your company switched health plans. Is my doctor on this plan? But with the Medicare Advantage plans, sometimes the doctors don't take all carriers. So you want to be able to check your doctors, make sure they're in network. You don't want to assume. And each one of these plans, you'll never lose Medicare benefits, but they'll all give you some different extras depending on the company that you choose. So at Blue Cross, we have 4 HMOs, we have 3 PPOs. If you go to a different carrier, you're going to have that same type of portfolio. There's a lot of options to choose from. Just to give you an idea, like let's say you pick a zero premium plan. You say, what am I going to get for a zero premium plan? You're going to look at it and say, well, this plan is zero. Maybe last year I went to my doctor 10 times. And on that plan for specialty care, the copayment was $50. And if that's all that happens next year, a zero premium plan, $50 copay, 10 times, I paid $500 out of my pocket. I had my medical, my prescription extra. It worked out great for that person, but nobody has a crystal ball too. So that's why these plans also have out-of-pocket maxes. If that year goes astray and all of a sudden you're in the hospital, labs, x-ray, there's an out-of-pocket max, and they'll vary from plan to plan. But let's just say a zero plan could be around $5,000, $6,000 up or down. But you say, all right, well, I'm going to take that zero premium plan. If something goes astray, that's my risk factor. I know at the end of the day, I'll never pay more than that. So those are some of the things that you would look at when you're trying to determine these plans. I always say, you're not making a decision for life. So know when you first go on to Medicare, everything's opened up for you. After that, if you're in Massachusetts, you can change your plans from Medigap to Medicare Advantage Part D every year, October 15th through December 7th for January 1st effective date. So nothing's a lifetime commitment. And again, if you find the right plan, it just carries over. And if you don't feel that you're on the right plan, you can change your plans every year. If you're in a different state, you just want to be aware of those Medicare supplement plans. There's different underwriting guidelines on those for changing. And there's always special enrollment. Like if you ever find yourself on the wrong plan outside of those dates, call the health plan. Talk to somebody called Shine. If they can find a special enrollment that lets you change, they will help you with that. And we talked about the higher Part B premium for your income. You can look here, and also higher income for Part D as well. What they're doing is they're looking really at your last tax return, so it's almost a 2-year look back. So again, talking to a financial advisor, maybe you're going to have to pay that based on, you know, if you sold a house, maybe when you first go into Medicare, you're just going to pay the regular premium. But you're looking at your tax return, it's a 2-year look back. If you do nothing and your income changes, they adjust it every year. But sometimes with life events, a divorce, a death, you've just stopped working, you can appeal that through Social Security. Did you have a question?
They always 2 years behind, so what you're implying?
Yeah, it's just based on your last tax return. So, you know, you work and then you put in it, you put through your taxes. So it's almost looking back 2 years when you're thinking about it. You're welcome.
And do they adjust it the following year?
They adjust it every year based on your last tax return. Yeah. And here's some helpful resources. Medicare, Shine, they're at your local council on aging centers. They can help you with your health plans and all this information. Mass Medline, they can help you pick a Part D plan. They'll let you know if you qualify for any assistance programs. We also have the Blue Cross number. So that is the Medicare information. As I said, it's a lot of information. I'm going to go through this for 1 minute, which is what if you need coverage before Medicare eligibility? So what your options are really going to be is if you have spouse, COBRA, or direct pay. We have them in order of what typically works best for most people. Spouse or partner plan. You're working, you retire, you have your coverage to your employer. Your spouse is working. Well, if that employer offers coverage, you can go onto your spouse's plan. Always the best bet, because if an employer's offering coverage, they're paying at least 50% of that premium. So not everyone's going to have that opportunity. So then you're going to look at COBRA, which is temporary continuation of your coverage. COBRA is nice and easy because it's the same exact plan that you have while you're working. It's just the employer is typically not shipping in for that premium, and you're going to pay 100% or 102% of that premium. But you know your COBRA plan, you know the cost of it. It's generally 18 months for employees, could be anywhere from 18 to 36 months for spouse or dependents. And you're going to take that COBRA rate and you could compare it to what we call the direct pay market. That means you're calling an insurance carrier directly. You're going to tell them your age, your zip code, You can get a range of premiums there. Usually the Cobra is going to be better. So just to give you a general idea, if you're 63 looking for individual coverage, you're probably planning on around $800, $900 a month for that individual premium. If you qualify for any subsidies, you want to go through the Health Connector. They look at your income, not your assets. It's pretty generous too. So if you did qualify, you would be able to buy a more affordable plan. So I appreciate the opportunity. I'm going to turn it back to Chris. So thank you so much, everybody.
All right. Well, before we switch gears or talk about other things, are there any more questions on the topic of Medicare?
So if you aren't collecting Social Security, but you want to go on Medicare, they send you a bill every month and they take it out of here.
They would just give you, it's quarterly, so you would cut it off with 2 and you pay quarterly.
I'm already on Social Security, I'm 64. My wife is still working. She has a kind of like healthcare from the public school. I understand I'll automatically get Medicare. Sometimes this year will send me a card automatically. She has another year to work, and I think she has a really good retirement plan in retirement. So what happens?
If you're collecting Social Security, you're already on a good employer plan. When you get that card in the mail, it's gonna allow you to now Medicare Part B. Because you don't want to be seeing that 16490 while you're waiting for working. So it will have instructions on what to do. So you'll have Part A, it's collecting you Part A, it's gonna be automatic, but Part B is denied. It will have that information as well.
Can you go on Medicare B or D and then go off it if your spouse gets a job?
Absolutely. So if you're on Medicare A or B, you can both employees, you can come off. Part A really can't come off without a big deal.
And then could you give us that drug reminder?
I'm
Calculator.
sorry. In the you can do it. The drug calculator, you can do it right on Medicare.gov, and you can also call Medline. They'll help you with your medications as well. And local council on aging, Sean counselors, if you, wherever you live, you can make an appointment. They'll help you with that as well.
My question is on this continuous open enrollment. So can you jump in and out of a Medicare Advantage, and then 6 months later you want to make a gap, and then 2 months later you want to go back to Medicare Advantage? Or how are there dates? Are you restricted by any dates?
Great question. So, she's asking about the continuous open enrollment. So in Massachusetts, the Medigap plans, like if you take a supplement and you're on, let's say you're on that 4 plan, and you want to go to the 1A, or you're on the 1A and you want to go to the 4, you want to go to a different carrier, you can do that at any time. Whatever month you call, they'll move it up or down the first of the following month. But when you want to go to a Medicare Advantage plan, let's say you want to go to one of those HMOs or PPOs from that, you can only do that every October 15th through December 7th for January 1st effective date. So even though the Medigap plans have continuous open enrollment, you can't just come off of a Medicare Advantage plan. They have certain rules of when you can come off of those plans. So generally speaking, it's every October 15th through December 7th for January 1st. Also, if you're on Medicare Advantage, they'll say come January 1st, what will happen is people will be on Medicare Advantage plans, HMOs or PPOs, and any type of changes that will happen for that coming year will be communicated before October, before the changes take place in January. But sometimes people get too much information in the mail, they don't look at it. So come January, you go to the doctor, you pick up your medication, you missed that information, and you find out on the phone bill or wherever you're going. So if you are on a Medicare Advantage plan, you have one extra opportunity, January through March 31st, to change your plan, go back to a supplement. One change. But come April, you're on an HMO or PPO and say, I wish I was on the supplement. Too late. You have to wait until that October 15th.
In the same with the drug plan,
The draft plans you can only choose one a year, October 15th through December 2nd.
Okay, lots to think about. Marcia, we did get a few questions. I don't know if you mind putting the microphone back on. That we got a question or two that came in advance. Someone wasn't able to attend. So one of these was this issue. The husband and the inquirer are 66. Full retirement age, 66 and 6 months. They have a business that both get income from, and passive income. Should we wait until 70 to collect in order to avoid taxes? Or is it just inevitable? And their fear is in waiting until 70, one of them could die and not enjoy the benefits of the amounts that they're missing out on. And they don't need the money right now. I have a few thoughts. I'm sure you do as well.
exactly. Well, first, let me say, I'm not a CPA, so that's your starting point. And, you know, don't you just love this? I don't need any money, but I could die. Well, at least I don't think it's run bankrupt. So that's a plus. This is another one of those situations that is super dependent on everything else they have. So what would be great, and you're so close to FRA, you know, don't claim today. So at least wait until 66 and 6, because you're that close. So you don't want to have any clawbacks. Because if they're getting income, they're still before full retirement age. So for the remainder of the year, they might not get any money from Social Security. So they may as well wait there. Now, do they wait until 70 or not? This is what's interesting about Social Security. We see this a lot, that this idea, I mean, really our mortality becomes a lot more clear the older we get. So it's, yeah, it's all about taxes. I mean, it's income here in America equals taxation. So it would be running a scenario. I love the tool you showed. You know, this would be a scenario.
Well,
really
one
is my
question
tax?
is, how's your health?
Right.
You know, that could be a relevant consideration. If you had some issues, some ailments.
Yeah.
That you knew was a factor. The other consideration is, who's the higher earner? And who's gonna be the benefit that sticks around the longest?
And do you have
Who's-
any minor children? You know, I worked with one gentleman, kind of this situation, and he is adamant, he's going in at FRA because he happened to have 2 marriages, group of kids, much older, and he's got twins, 11-year-olds. He wants them collecting on him. So, you know, until you know the whole situation, there's no way to really answer these questions, but don't you just love how creative people get?
Yeah,
And yeah, everything is taxable.
we had another question, a family where, husband and wife, he's a US citizen, she's a dual citizen, hasn't had full credits for her working, the 40 credits. She's worked, but been at home, stay-at-home mom, and then part-time at a school, you know, so not contributing into the system. Is she eligible for benefits as a spouse, or if he should pass for survivor benefits?
Yes, she is. Married is married. And so and even if she didn't have dual citizenship, you know, maybe had a green card, maybe, well, she would have had a green card if she were working, you know, if she were not a dual citizen. But yes, when you're a spouse, you are entitled to spousal benefits. Half of his would be her maximum payout. But also if she worked, depending when she came over to the US, she may have dual citizenship, but she ever work in her original home country. And if so, there are these totalization agreements between the US and a whole lot of, especially Western Europe and South American countries.
This was Spain in this case.
Oh, Spain. So we have a totalization agreement. And if she worked over there and had some pension that she earned, it will be coordinated. So this is a matter of first start with Social Security, see what they have to say. And then I always advise people, make sure you talk to an international attorney who is truly expert in this area. Because you don't want to leave any money on the table, but you want to know, you know, if you have anything coming to you.
Thank you.
Sure.
All right. And both our speakers are available for a few minutes after the program, if anyone wants to talk a little more about their own individual situation. I do want to remind you as well that we have resources available to you through our website for our clients and our guests. So take advantage of some of those. We have a podcast and radio show that hopefully keeps you up to date. Marcia was just on a month or two ago. We're gonna have Susan on soon to talk about things as well. But in any case, so there's these kinds of resources that you can take advantage of if you're not paying attention to them as well. We have a blog we've just started recently. And I want to mention again that, what's next? If you would like to, let's talk. We offer a complimentary consultation. And for those who would like to sign up today for a meeting, we'll give you a 10% discount off our services. If you just wanted to do a financial plan, typically a financial plan costs $2,500 to $5,000 as an estimate. We'll look at your particular situation and put together a sense of that for you. And then if you ended up wanting to work with us on an ongoing basis, we include financial planning as part of our portfolio management services. So we would cut that cost in half of whatever your cost was. So in any case, in some form or fashion, if we can be a help to you, let us know whether it's today or on your evaluation form that you'd like us to reach out. We'd be happy to reach out to you. So before we finish up, we have something fun. Kathy, why don't you come up and handle this?
All right,
We have a little drawing, right?
we do. So we've got one winner will get 2 of Marcia's books and something more with Chris Boyd coffee mug. So that's the radio program and podcast that we put out from AMR every Saturday, 3 to 5 on WXTK 95. So
Or wherever you listen to podcasts.
right, you can hear Chris and some of our other planners on Saturday. You can live stream it or watch the podcast after. And then the other 2 winners will win 2 of Marcia's books. So let's see what the lucky
All right.
people are. Woo.
And while Kathy's doing this, well, let's give Kathy a round of applause for all the organizations. Thank you, Kathy.
So Michael O'Brien. Hey,
All
Michael.
right. Very good. Who's next?
Let's see, I know you're all waiting with bated breath, right?
Everybody wants their book.
Lou Orphan. Hey, Lou. And I'll just do the last one right here so I can maximize my,
Yeah.
and Julie Kimball.
All right, awesome.
Okay.
Well, thank you, everybody, for attending. That concludes our presentation. Feel free to ask questions. Please submit your evaluation. Let us know if you enjoyed today, if there's anything we can help you with. Thanks for being with us. We hope to have the recording posted within a day or so. So feel free to go to the website if you want to rehear some of this information. Thank you.